98% of those who are aware of this status are on treatment, and 96% of those on treatment are vitally suppressed. This is a remarkable achievement. This means that 96% of Zambian adults over the age of 15 living with HIV and on treatment cannot transmit the virus to their sexual partner. This is a remarkable, as I said, a remarkable achievement, but we can and we still must do more. We will use this time together over the next 3 days to expand on our work, identify how and where lessons learned can be helpful, to get more children on treatment, to close the tap on new infections among adolescents and young people, and to ensure that all people have equitable access to essential prevention and treatment services. In closing, I would like to thank the government of Zambia for its continued partnership in managing these compounding and intersecting disease burdens, and for its unwavering commitment to ensure equitable access to health service delivery in Zambia. Today, at this 2022 National HIV, TB, COVID-19, and Viral Hepatitis Technical Conference, I encourage you to engage in fruitful discussions that will address barriers to containing these public health threats of COVID-19 and TB, while still sustaining our significant aims toward ending AIDS in Zambia. Only together will we learn, adapt, and strengthen our response to infectious diseases in Zambia. Thank you very much.
Thank you very much, Emily. Finally caught on who I was. Yeah, I would now like to call upon Professor Lloyd to call upon the Minister for keynote speech.
Guest of honor, Honorable Minister, again, we are grateful for you coming to officiate at this important occasion. We are ever grateful for the support you give to the program. I wouldn't like to waste more time, but call upon you to come and deliver your remarks, Honorable Minister.
Thank you. The representative for the U.S. ambassador is Emily Bowles, is also country office. The UN AIDS country director, who is represented by Dr. Caroline Olwande. Chair of the Global Fund Country Coordinating Mechanism, Dr. Bishop Joshua Banda. Our co-chair, rather the chairperson of the conference, who is also the National AIDS Council Director General, Dr. Fanny Osborne. I want also to recognize the Director for Network of Zambian People Living with HIV, Mr. Fred Chungu. Director for National Health Research Authority, Dr. Godfrey Diemba, I recognize you. I also want to recognize the co-chair for this conference, Professor Olenga, indeed other directors from the Ministry of Health are present, members of the press, distinguished guests, ladies and gentlemen. I'm delighted to welcome you to the 15th annual HIV, TB, COVID-19, and Hepatitis B virus technical conference. This conference is under the theme, Every Person Counts, Closing the Gaps
for HIV, TB, COVID-19, hepatitis B virus through responsive, resilient, and integrated health systems. This is an appropriate theme as it fits the need to consider everyone, including those populations that have had challenges with access to care and support, especially the children and adolescents. Further, the theme encourages all of us involved in the HIV, TB, COVID-19, and hepatitis B virus epidemic response to build resilient systems that are integrated. Integrating healthcare systems must be a legacy that we should learn from the COVID-19 pandemic response. This conference brings together all technical experts in the field of HIV, TB, COVID-19, and hepatitis B virus to discuss scientific discoveries and innovations. It further provides a platform for sharing the best practices in order to address these diseases of public health importance. Distinguished guests, ladies and gentlemen, barely 2 weeks ago, during the World AIDS Day, the Minister of Health proudly announced the results of the 2021 Zambia Population HIV Impact Assessment Survey, known as Zambia 2021. And on the onset, let me say thanks to our cooperating partners, in particular, its government and its people, for their great support towards this project. These results showed the progress we have made towards the control of HIV. We now know that 89% of all Zambians living with HIV know their HIV status. Of these, 98% are on life-saving ARVs, and of these, 96% are virally suppressed. Dear participants, these results are a milestone as they show that 86% of all Zambians living with HIV are virally suppressed against a target of 84%. Despite this progress, the issues of equity, sustainability, decentralization, and innovation must be the focus to ensure that we attain the end AIDS by 2030 goal. Distinguished guests, ladies and gentlemen, the Ministry of Health has recognized the dire need to ensure sustainability of the response of these epidemics through domestic funding. So, Bishop, when you talk of domestic funding, I'm happy to inform you that this has been taken note by this administration. And to this effect, the UPND-led government has increased the overall health budget from 9.2 billion kwacha in 2021 to 12.4 billion kwacha in 2022. The drug budget
has been increased from 1.4 billion in 2021 to 3.5 billion in 2022. The government's contribution to the national HIV-related commodity need has also been increased from $25 million in 2022 to $35 million in 2023. This is in addition to the historic employment of over 12,000 healthcare workers within a year of being in government. Distinguished guests, ladies and gentlemen, as we progress towards the final lap in the efforts to control these epidemics, equity is critical. Colleagues, the data is clear on the populations that have been left behind and are at a higher risk of these infections. For instance, we know the prevalence of HIV. We know that it is 50% among female sex workers compared to the 11% in the general populace. We also know that the viral load suppression is at 80% among children compared to 96% among adults. We therefore cannot continue to use generalized approaches. It is therefore my sincere hope that this conference will demonstrate best practices in the implementation of specific population-targeted interventions. Further, let us also find ways of ensuring that these interventions are sustainable, scalable, and efficient. My dear healthcare workers, scientists, and program leaders, inequalities are also geographically and regional. Most notably is the difference in the control of these epidemics between rural and urban areas. To this effect, this government, under the leadership of His Excellency the President, Mr. Hakainde Hichilema, is promoting the decentralization agenda. This is not a new policy. This is an old policy that Zambians in general agreed to pursue. But you will agree with me that successful governments have made attempts but fallen short. This time around, there is excellent political will from the highest office to see through the actual implementation of this policy, especially in the health sector. And to this effect, I'm also pleased to tell you that this minister is a true believer of this policy and will push it through. And I'm calling upon all you colleagues in the health sector to move with the government of the day in ensuring that we implement this policy. It will help the sector, I have no doubt. The 78% we're talking about today is partially as a result of the decentralization implementation policy that we pursued by ensuring that we worked closely and directly through local authorities, through traditional authorities, through church leaders, and indeed the communities themselves, and of course with the support of our cooperative partners. So, this said, it is my sincere appeal that all of you embrace this innovation. The people in sub-national areas understand their problems very well and therefore are best suited to drive their own agenda in finding homegrown solutions according to their priorities for maximum impact. It is my hope that these issues of decentralization will therefore be discussed during this conference. And I hope that those from the Ministry of Health that are quite close to this issue will help in articulating how far we want to move. Distinguished guests, ladies and gentlemen, allow me to encourage you to integrate the responses to these common epidemics. These epidemics must not be responded to in silos. The Ministry of Health is looking forward to a time when the same responses for HIV must be used for other infections or infectious and non-communicable diseases. Notably, I'm aware of the integration of the hepatitis B virus elimination with the prevention of mother-to-child transmission of HIV, called the triple elimination of HIV, which includes HIV, syphilis, and hepatitis B in children. Other programs should similarly follow this example, as integration allows for the leveraging of resources and supports the sustainability agenda. Colleagues, ladies and gentlemen, Zambia has successfully reduced the number of COVID-19 cases and attained the 70% milestone for vaccinations against COVID-19. I'm happy to also note that we are now beyond 78%. In some provinces, they have actually hit 100%. My appeal, however, to all of you is for us to keep our guard up and not allow weariness. Researching COVID-19 and other emerging and re-emerging pandemics must continue. Surveillance in COVID-19 must continue. Epidemic preparedness for COVID-19 must continue. Training in COVID-19 management must continue. The fight against COVID is not yet over. Distinguished guests, ladies and gentlemen, equally, tremendous improvement has been made in controlling TB in Zambia. Case identification has improved to over 50,000 cases per year, with an incidence of 319 per 100,000 people. The drug resistance survey results have shown that the prevalence of multi-drug resistant TB in Zambia is currently less than 3%. The provision of preventive TB therapy coverage has increased to 70% of all those receiving antiretroviral therapy. This means that over 1 million people have received the TB prevention therapy, the TPT. This increase in the coverage of TPT has resulted in the reduction in the TB incidence. Now, for Zambia and yourselves. Distinguished guests, ladies and gentlemen, I cannot praise the work of the healthcare providers enough in achieving these milestones we see today. Let me also acknowledge the input from the civil society who have been there to not only guard, but also remind us on what person-centered care means. The civil society has also been there with the programs, with the programmers and providers in the field to encourage recipients of care to visit the facilities. I also appreciate the support this government continues to receive from the international partners, both bilateral and multilateral, in fighting these pandemics. Distinguished guests, ladies and gentlemen, as I've said before, our achievements are commendable. Less people are dying. less babies are being born with HIV. But we cannot afford to have an increasing number of new HIV infections. Even the newly released estimates of 28,000 new HIV infections per year are way too high. The administration of His Excellency the President of the Republic of Zambia, Mr. Hakainde Hichilema, is concerned new HIV infections have the potential to reverse the gains that we have made in the HIV response. What is also more concerning is that most of these new infections are affecting adults and girls and young women. This issue needs special attention from you experts gathered here. Ladies and gentlemen, as you meet here to deliberate on updates, best practices, and new developments, I encourage you to have the discussions that should be translated into effective, community-oriented health services that will benefit our Zambian people. Ladies and gentlemen, recently, there has been several reports of some people claiming to have medicines that cure HIV. These individuals are asking for money from people living with HIV to buy these medicines. Fellow Zambians, as of today, we have no cure for HIV. Let us not be swayed by these individuals. They are after your hard-earned resources. Let's use the best available and scientifically proven medicines to treat HIV. As Minister of Health, I will not hesitate to fast-track the approval locally of any scientifically proven cure to be available. But we will not allow fellow citizens to be robbed of their hard-earned money through these schemers claiming to have cures for HIV. Distinguished guests, ladies and gentlemen, I will be launching the new 2022 Zambia Consolidated Guidelines for the HIV treatment and prevention in this conference. These documents should guide us. However, effective management of both HIV and COVID-19 is beyond these guidelines. As we implement them, let's have a human and caring heart to the people these guidelines are meant to serve. Let me remind you as well to effect what is in the guidelines. Let us make the long-acting injectable ARVs a reality for our adults and girls and young women who need effective HIV prevention. Let us make the long-acting injectable ARVs a reality for those of our young people who struggle with tablets for HIV prevention. Let us make the long-acting injectable ARVs a reality even for those people living with HIV on third lines and taking several tablets daily. In short, let's adopt innovations that will suit each one of our people and subgroups. Distinguished ladies and gentlemen, it is now my singular honor and privilege to declare the 15th National HIV, TB, COVID-19, Hepatitis B virus technical conference officially open. Together, we can ensure that everybody counts. Together, we achieve equity. Together, we can achieve epidemic control. I thank you for your attention and God bless you.
Sure. Thank you very much, Honorable Minister. We will now move to the launch of the various documents. And right, we'll move to the launch of the Zambia National Authority guidelines. I will request that the high table should come up. Okay.
Good afternoon, everyone. Today, we will launch the Zambia Consolidated Guidelines for Treatment and Prevention of HIV, the National Pre-Exposure Prophylaxis Program Monitoring and Evaluation Implementation Guide, the Zambia National Sexually Transmitted Infections Treatment Guidelines, and last but not the least, the Manual of Standard Operating Procedures for Human Resources for Health for the United States Centers for Disease Control and Prevention Cooperative Agreement. Okay, before the high tables take their seat, we're also taking this opportunity to give the awards to the best performing and most improved performing provinces. We have three categories, of course, based on the theme of the conference and the subject matter of the conference. The first award is for the best performing province in the attainment of the 95, 95, 95 targets. And the award goes to Southern Provincial Health Office. Let's give them a big hand. Can we have the PhD or the clinical care specialist to come through, please, to get the award? Any representation from Southern Province? Let's give them a big clap, please. Let's give him another hand, please. The next category is for the best performing province in COVID-19 vaccination. And the award goes to Northwest and the award goes Let's give a clap for Lampula Province again, please. And the invited guests will take the seats.
Thank you very much, Dr. Mumzi. We are quite behind time. We'll maybe request that we very quickly grab a cup of tea. Maybe we can break off for 10 minutes before we come back. Maybe do two presentations before we can break off for lunch. So this is me officially saying tea ready. We'll be back here in the next 10 minutes. Tea is on my right. Over the side. Thank you very much. Right, sorry, I have just been corrected. We will now have the vote of thanks. I believe that Mr. Chumbu. And then we'll do a photo shoot before 14. Thank you.
Thank you. The guests of honor, Honorable Minister of Health, Honorable Silvia Macero, the NAC Director General, Dr. Kony Ompon. Ladies and gentlemen, allow me to write on the protocols already observed by the previous speaker. I'm very pleased to have this rare honor and privilege to move this vote of thanks at this year's 15th Annual National HIV/TB COVID Viral Hepatitis Technical Conference under the theme "Every Person Counts: Closing the Gaps for HIV/TB COVID-19 Hepatitis B virus pandemic through responsive, resilient, and integrated health systems." I thank the organizers of this event. On behalf of civil society and the network of Zambian people living with HIV and AIDS, I wish to take this opportunity to thank most sincerely the Minister of Health, Honorable Silvia Macero, and all of you for finding time to attend this very important event. Distinguished guests, ladies and gentlemen, as people living with HIV and AIDS, we appreciate the efforts the government is making in combating HIV, AIDS, such as uninterrupted supply of HIV treatment and the provision of HIV testing services, just to mention a few. However, in closing the gaps and in order to maintain the gains we have made as a country in fighting HIV, TB, COVID-19 and hepatitis B, civil society and NZP Plus would like to appeal to the government to ensure access to viral load tests to all people living with HIV. Ensure that medicines to manage non-communicable diseases are available in all health facilities. And again, ensure that the information on COVID-19 targeted for people living with HIV is readily available. As civil society and NZP Plus further appeals to the government to allocate adequate resources for HIV prevention for adolescents and youths. The recent increase in the new HIV infections among adolescents and young people, people aged between 15 and 24 should worry us all. We also appeal to the government to increase funding to community interventions. As civil society and NZP Plus, we remain committed to positively contributing towards the global goal of ending AIDS by 2030. I thank you all once more for attending this important event. I thank you and may God bless you.
Right. We will have the first two presentations from the plenary session. I believe that Professor Lloyd Mulenga is the first to present. Right, sorry about that. We will now have the presentation from Dr. Laston Chitemu, WHO. Thank you.
And then we allowed to introduce Dr. Laston Tembo. He's a pediatrician and a child health specialist who has worked in the field of HIV for more than 2 decades. He has worked both at national and subnational level. He also worked for UNICEF for about 7 years, and currently he's working for WHO, and this is his 8th year. So please go ahead.
Thank you very much. The Honorable Minister, welcome, and we thank you for coming to this important. Simply marks how important you attach your works to the work of HIV, and we want you to continue doing this. Ladies and gentlemen, I wish to write on the protocols for the previous speakers. In this regard, all protocols are clear. My presentation is about the global health sector strategy. This is usually it's been like a 5-year, what globally the World Health Organization plans to assist the countries on how we should move forward. And for this year, they've actually released what they call the 2022-2030, because the whole world wants to work towards ending HIV, ending STIs, and also eliminating viral hepatitis by the year 2030. And they've been trying to see how can we work with countries. So that's the title of the presentation. So what is this? Basically, guidance for health sector implementing strategically focused responses. Like I said, for the goal of ending HIV. Next slide. Now, if you look at that slide, you see the top 3 for the 2016-2021. That was a 5-year global health sector strategy. What we had as WHO, there was one document for viral hepatitis, another one, a separate one for HIV, then a separate one for sexually transmitted infections. For the current global health sector strategy, WHO has merged all those 3 documents into one, the one you are seeing, the blue one. So those 3 diseases are no longer moving alone, they are moving as a team. You may ask why. Next slide. Of course, those diseases, you know, they are kind of interrelated. Now, if the global world wants to move as one, don't you think, if you look at our national HIV strategic framework, do you think we should continue calling it National AIDS NACI, or we should be calling it National HIV TB STI Hepatitis? What do you think? I think that's food for thought. How we move on. Because let's ride on HIV. Let's do what we can. Because now we are talking about people centered. Similarly, we've just launched one of the documents here. It's like this. The HIV guidance. Next slide. The guidelines for HIV, it's also called Zambia Consolidated Guidelines for HIV. But I think time has come. As we think about the person, we start calling it no longer Zambia Consolidated for treatment and prevention of HIV, but HIV, TB, STI, hepatitis. Just like we are here, that's the theme we are seeing in this conference. Before it used to be called HIV Technical Conference, but things have evolved. So I leave that to the ministry, the partners, and all of us seated here to think twice. What do we do next year? Next slide. Like I said, all those 3 diseases share common modes of transmission and determinants, and many of the population